morning, students. Today we are going to discuss about one of the topic. It is retinopathy of prematurity. It is under the subject of child health nursing 1. What is retinopathy of prematurity? It is a blindness eye disorder that it is primarily affect the premature infants with a low birth weight babies. It is one of the leading cause of preventable childhood illness worldwide. So for this, we have to identify early detection and timely management is very essential to prevent the permanent vision loss. So what is the causes? This mainly caused by prematurity babies and also low birth weight babies. It is main factor it include premature birth, especially it is very less than 32 weeks, or very low birth weight babies less than 1500 grams, and high or fluctuating the oxygen therapy, that is respiratory distress babies, and sepsis or anemia or poor postnatal weight gain, and premature infants are born before retinal blood vessels have fully developed and increasing the risk for abnormal growth. So this is the causes of premature of the retinopathy. Mainly premature babies and low birth weight babies are commonly affected this retinopathy. If we can identify early, we can prevent this vision loss for the premature babies or low birth weight babies. So what is the pathophysiology? Vasoconstriction, maybe high oxygen level cause the blood vessel to the constrict, and vasoablation, that is oxygen toxicity lead to the vessel loss, or nervovascularization, so it lead to VEGF release promote the abnormal vessel growth, and fibroproliferation, maybe scar tissue forms potentially causing the traction, and retinal detachment and severe ROP lead to vision loss. This is some pathophysiology lead to retinopathy of prematurity. Next it is stages. Stages of retinopathy of prematurity. It have 5 stages. Stage 1, mildly abnormal blood vessel growth. Stage 2, moderately abnormal vessel growth. Stage 3, severe abnormal vessel growth with external fibrovascular proliferation. Step 4, partial retinal detachment, may be not involved macula or involving macula. Stage 5, total retinal detachment, end stage disease, and we can say it is pulse disease, dilated and tortuous posterior retinal vessels, and it indicating severe active disease. So this is the picture says what different types of stage 1, stage 2, stage 3, stage 4 and stage 5. Next it is symptoms. So mainly the symptoms, it is asymptomatic. We can early sign symptoms appear only in advanced stages, may include abnormal eye movements and white pupillary reflexes and strabismus and poor visual tracking and vision loss in the last stage. With that only we can confirm the baby have a retinopathy of prematurity. And complication, if untreated, this ROP can lead to retinal detachment and permanent blindness, myopia, and amblyopia, glaucoma, and cataract. So what is the management for that? Based on the stages and severity, we can give a treatment. First, it is a very important screening. Premature infants less than 1500 gram or less than 32 weeks, we have to undergo the regular retinal examination. It's starting at 4 to 6 weeks after the birth, and laser photocoagulation we have to give to reduce the VEGF production, and Intravitreal anti-VEGF injection we have to administer if any severe ROP it is there, and vitrectomy or scleral bucking we can do for advanced stages if the baby with the retinal detachment. And supportive care, oxygen monitoring we should be very careful, and weight gain and nutrition we have to optimize, and we have to give some systematic treatment if anything present to the children, and regular eye examination throughout the childhood to detect the refractive error. And what is the nursing diagnosis? So risk for visual impairment related to abnormal retinal vascular development in the prematurity, so intravenous and monitor infant eye examination, follow up care, and exposure to any bright lights and to be reduced, and maintain soft and developmental appropriate lighting, and collaborative with the healthcare team to maintain the safe oxygen level, and educate prevent on signs of visual difficulty and importance of follow up. Next, it is risk of infective peripheral tissue perfusion related to immaturity of the vessels. So we have to give oxygen saturation monitor continuously, and we have to adjust with the protocols, and rapid fluctuation should be avoided, and gentle handling of the baby to reduce stress, and maintain the stable systemic perfusion to support thermoregulation to prevent increased oxygen demand. And anxiety mainly for the parents to related to unfamiliarity of the retinopathy of prematurity and its potential of vision loss, so provide simple clear explanation about the disease and treatment, and offer the emotional support and encourage the parents to participate in care, and use the visual aid or model to help parents understand the eye findings, encourage the questions, and ensure the consistent communication. So this is about retinopathy of prematurity. It's serious but preventable causes of childhood blindness. Early diagnosis through the systemic screening and promote the treatment can significantly reduce the complication. With the improved neonatal care and timely ophthalmic intervention, the long-term visual outcome of the affected infants can be greatly improved. I hope everyone understand about the retinopathy of prematurity. Thank you.